Hello, everyone. My name is Chloe Edwards. I'm with Voices for Virginia's Children, and today I'll be sharing a webinar with you on the 2020 Campaign for Trauma-Informed Virginia session results. Voices had just finished up the 2020 General Assembly session back in March, and we now would like to present the results to you and also some opportunity for continued advocacy around uplifting these issues, as many of these items are now not promised due to the COVID-19 pandemic. So if you're not familiar with Voices, we are Virginia's only multi-issue child advocacy organization. We specialize in issues surrounding early care and education, family economic security, foster care and adoption, health and well-being, mental health, trauma-informed care, and resilience. We're privately funded. We intentionally only accept private funding because we want the freedom to advocate around issues that uplift the voices of children the most. And we're also a nonprofit, so we work with everyone. We're a 501c3. We work with Republicans, Democrats, Independents, etc. We really focus on the heart of the issue, which is the policy that impacts children. Voices is also home to the Virginia Kids Count Data Center, tracking over 40 indicators of child well-being by locality, and over 150 at the state level, where data are formed in all of our issue areas. We use the data stories in our unified policy agenda in order to influence legislation. You can always reach out to our research director, Lauren Snellings, lauren@vakids.org. Our data center is in partnership with the Annie Casey Foundation, and there's a similar Kids Count data center in every state that's usually paired with an advocacy chapter. So what is the role of Voices for Virginia's Children? Well, we serve as a neutral convener because we don't accept public funding. We create a data-driven policy agenda that shows that there's a need around the advocacy that impacts our issue areas. We serve as a policy translator for advocates, professionals, the legislature, etc. And then we serve as a convener, so we connect other organizations with similar goals in order to develop a unified voice to use similar talking points. We also build awareness around electoral advocacy and making sure that issues that impact children and families are highlighted. So what's ahead for 2020? Well, like many of you may be feeling, this is definitely a year of uncertainty, especially as it relates to our 2020 General Assembly session results. We will know more by the end of this weekend how this impacts the budget particularly. But Voices is currently responding to COVID-19 in all of our issue areas. The ones that you saw earlier on the screen, we're lifting up access to childcare and the need for the childcare workforce. We're hoping to protect children and parents and communities that are particularly vulnerable or maybe experiencing toxic stress as a result of the pandemic. We're thinking of the child and family holistically. So also thinking about behavioral health and mental health and encouraging access to telehealth and mental health supports during this time. We're also thinking of the economic impact of the pandemic on children and families and identifying possible resources in order to ease that economic trauma. We're looking forward to the return for special session and then opportunities to uplift priorities within our issue areas that we hope can still be offered to children and families from the 2020 General Assembly session. We're also looking at new areas that we'll need to further uplift as a response to the COVID-19 pandemic and the impact that that has on the social determinants of health. We're currently conducting conversations at the local community level with trauma-informed community networks to analyze next steps for the Campaign for Trauma-Informed Virginia this year. And we're preparing for the Championing Change Advocacy Summit, November 2nd, 2020, which will be an opportunity to offer advocacy tools, resources, methods of empowerment to communities, youth leaders, families, and more. You can also go to our COVID-19 resource page. It's at vakids.org/COVID-19-responses-resources, and how we're responding to the pandemic in each of our issue areas. The General Assembly session is also scheduled to return April 22nd. Make sure that you're sharing what's going on in your community with us, how your organization or community may be responding to the COVID-19 pandemic. And then also, as we go through this webinar, look at each of our session results that I present to you, and feel free to offer any insight on how your community may be addressing the local budget or any of your concerns for the 2020 General Assembly results being uplifted, anything that you feel should be prioritized. So I encourage you to shoot me an email on what's happening in your locality. I am Chloe, CHLOE, at vakids.org. So what is the Campaign for Trauma-Informed Virginia? Well, back in 2017, Voices for Virginia's Children began seeing more momentum around trauma-informed care in Virginia particularly. Then there were 6 trauma-informed community networks. We began with education to the state legislature and having a trauma-informed community network advocacy day in order to showcase the concept of trauma-informed care and also the work that these local communities were doing within these multidisciplinary spaces. And so there was a state resolution recognizing the work of the trauma-informed community networks at that time at the state level. And then since then, the education around this topic has grown. There's currently over 20 networks across the state of Virginia. You can go to vakids.org, click the trauma tab in order to see your closest trauma-informed community network. This mini site that you see here offers resources for advocates, policy updates, policy translation. It also features our unified policy agenda with over 40 partner organizations signed on, and then multidisciplinary updates and blog posts. And here you see the trauma-informed community networks who came with teams to the Virginia Summit on Childhood Trauma and Resilience in April of 2019. And then now you see a model for the framework for building and maintaining a trauma-informed community network. This is created by the Family and Children's Trust Fund. It follows the scientific model of MARC, Mobilizing Action for Resilient Communities. There have been opportunities for the networks to receive Family and Children's Trust Fund funding. There isn't currently enough funding for all of these networks, but this is the model that each of them are following as a best practice. So how did we build a scope of this unified policy agenda that's cross-cutting and impacts all systems that impact children from the social determinants of health standpoints? Again, we use the framework where we're data informed, use stories to contextualize that data, and then we present the unified policy agenda. The agenda, as you'll see, is multi-issue. It's where best practice meets sustainability through political opportunity at the state level. And we use an equity lens to uplift policies that promote equitable opportunities, particularly through data disaggregation in order to highlight disparities and an opportunity for a higher distribution of resources to meet these needs of these communities. And so my colleague Mary Beth and myself, my colleague Mary Beth covers the northern region of Virginia, working with trauma-informed community networks, and I covered the rest of the state. We've attended trauma-informed community network meetings for over a year, and we've been analyzing conversations for trends around best practices to trauma-informed care, as well as challenges to trauma-informed care and building community resilience. And through this analysis, we worked with our policy team at Voices for Virginia's Children, who identified political opportunity and particular issues that we could uplift. So we work to, from an outreach and engagement perspective, to empower local communities to advocate at the General Assembly session by offering resources around advocacy tools. And then we also work to engage in identifying particularly issues that really show through stories the need for the policy agenda item we're presenting. Each year we have a number of advocacy days. I'm going to attempt to play this video of the Campaign for a Trauma-Informed Virginia Advocacy Day this past year. This is the legislative component of the day, but you can also go to vakids.org to get a full overview of the day on our campaign site. So let's see if this works.
When people see me, they see wishes for people to come together. Imagine her confidence. Don't change how for people to come together. Imagine her confidence. Don't change how wishes for people to come together. Imagine her confidence. Don't change how I am. When people see me, they see wishes for people to come together. Imagine her confidence. Not the don't change how people look at I am.
All right, and you can also go to VA Kids on our YouTube page to see examples of our other advocacy days. But as you see, advocates are attending legislative meetings, they're getting the full General Assembly advocacy experience. And it just goes to show you that anyone can participate in advocacy. That's one of the fundamental principles of democracy. And when you have lived experience or a level of expertise in your issue area, then that can be used to really educate and inform legislation. So here's just a basic overview of our unified policy agenda from a high level standpoint. And then I'll go into some of the intricacies of this unified policy agenda around trauma-informed care. So here you see, again, this is an example of a cross-cutting unified policy agenda. Each of our policy team members looked within their issue area, identified a trauma-informed care lens around issues that are holistically impact children. And then we developed the unified policy agenda with that constant theme to create the 2020 trauma-informed care initiatives. So this first issue around community level prevention, the goal is to provide community resilience. We see the trauma-informed community networks as a key resource in ensuring that professionals from different issue areas with this one commonality around trauma-informed care can develop best practices, mitigate trauma should it happen, but also prevent trauma at the community level. So for the second year in a row, we've advocated for funding to support community-based trauma networks. This year we did receive some session results through our advocacy around the Family and Children's Trust Fund. Family and Children's Trust Fund, there's an example of these kids' first driver's licenses that you can purchase at the DMV that goes to that. But it's a public-private entity. It's been the only state agency providing funding for trauma-informed community networks. The Family and Children's Trust Fund has dedicated all of their funding to these trauma-informed community networks, but in fact, only has enough money to support 6. And there are now 26 of these networks. So the session result is that if 5 communities decide to allow casinos through a voter referendum, FACT is included as a dedicated recipient. And it is an estimate that FACT could receive an additional $300,000 per year in 4 to 5 years as a result of dedicated revenue that would come from these casinos. Now, again, when we talk about how the COVID-19 pandemic will impact this funding, one issue that will need to be addressed is the state budget. The budget was passed before this pandemic. It will have to be analyzed again as a result of the economic impact of this pandemic and funding streams that will have to possibly need to go elsewhere. So here you see an example of the Southside Trauma-Informed Community Network. The network leader or convener is Brian Little. And this was an example of seeing a network up close.
I am Brian Little, convener of the Southside Trauma-Informed Community Network, and we are Trauma-Informed Community!
Right, so that network's particularly in Southside. Virginia covers Petersburg, Emporia, Greensville, Dinwiddie, etc. Now, one of the first steps that a trauma-informed community network takes is usually they have some sort of resilience screening that's launched to educate and raise awareness in the community. But then after that, usually networks begin training professionals in the community that work directly with children, families, or anyone for that matter, to be trauma-informed. So the ACES Interface Train the Master Trainer program is a program used to raise awareness, provide education at the community level around trauma-informed care, and then it really ignites the momentum in the community because you have trainers training trainers as a scientific model research-based model that is followed, but we need more administration and oversight in order to strengthen this program. So the additional 143, a little over $143,000 per year will be dedicated to a position and a half to continue ACES interface training and oversight for this program particularly. This is being offered through the Department of Behavioral Health Services, DBHCS, at no cost to the communities. And so as a result, this is a very equitable program that communities can take advantage of. Well, it also included on here that the final budget included approximately $600,000 to continue the Linking Systems of Care program. This program delivers a referral and response protocol program, and it's ensuring that at the programmatic level, policies are trauma-informed, and then also identifying challenges around access to services in communities and ways in which we can combat that. So again, the Linking Systems of Care program has a similar model where you see it's cross-cutting, it's looking at the whole system, and then they're also partnering with organizations around screenings, around diversity, and Linking Systems of Care has more information about that if you're interested in learning more. So now from the early childhood prevention or family-based prevention standpoint, this is an example, Healthy Babies, Healthy Moms is an example of how we can look at the impact of cultural, historical trauma and how that presents racial disparities when it comes to health outcomes. And so for our family-based prevention policy item, we have improved, infant and maternal health through policies that promote healthy births and reduce racial disparities. We were noticing that when it comes to maternal health and infant health, there's the disproportionality when it comes to the health outcomes around infant or maternal death. So by increasing access to doulas who serve as advocates in the healthcare space, and then also providing this access through Medicaid, this is an opportunity that we can combat our racial disparity through increasing resources. And so as a result, there's an additional $3 million in state funds, which is included to extend family moms eligibility for 12 months. And then additionally, DMAS is tasked with a work group to make recommendations regarding the state regulation of doulas through a community doula benefit program. So again, this is a way that we can tap into a state resource in order to increase equitable outcomes. Another way that we can combat disparities is through home visiting. Home visiting is a great program that offers support, additional supports to low-income, pregnant women, and families with young children, increased parenting resources, and then it's also connected to lower abuse neglect rates in those early care, essential development stages of children. So less than 10% of targeted families that currently receive prenatal and early childhood home visiting services to improve health connections and help parents in their role as their child's first teacher are able to receive this service. So by creating a Medicaid reimbursable service for home visiting, this will expand access to home visiting and bring down additional federal funds. So this also increases another protective factor for families when it comes to additional supports. So research also shows that when families are able to meet their basic needs, this also acts as a form of family preservation, and it decreases adversity over time as a result of economic hardship. So the temporary assistance for needy families, TANF, is a federal program that has a surplus already. By increasing funding for TANF payments and rates of eligibility, we can use this pool of funding as a way to mitigate economic hardship and trauma. So the session results was that the cash assistance and eligibility for TANF was increased by 15% over FY20. This would equate to approximately an additional $55 per month for a two-person household. Even with this eligibility increase, we do recognize that only working families in deep poverty below the 50% of the federal poverty level would still be eligible for TANF. So this is also a program that we're looking at as a possible pool of funding that could be used in response to COVID-19 as well. You can continue reading the Voices blog as we continue to analyze different resources. So in the early identification and intervention space, we wanted to address preschool and suspension and expulsion through an early childhood mental health consultation model. This is a model that initially is widely used in Northern Virginia particularly, but could be extended to the rest of the state. A recent study by the National Center for Children in Poverty found that 63% of Virginia's preschool teachers identified access to early childhood and mental health consultation as a top priority. However, there has to be a state agency that can be identified to provide oversight in order to implement this program statewide. The goal is that this program would decrease suspension and expulsion rates that occur regularly in early childhood settings through the utilization of this program in lieu of suspension and expulsion. It will also help to normalize regular childlike behaviors that could occur in the early childhood setting by additional resources. So HJ 51 passed both the House and Senate. DOE will form a work group to address questions and make recommendations for implementation. Again, this was a great result of advocacy in the 2020 General Assembly session. And just keep in mind that this advocacy may have to continue past this year as a result of the pandemic. So another resource that was implemented this past year, but not at the state level holistically, is the Virginia Mental Health Access Program. Last year, we received a little over $1.2 million to implement the Virginia Mental Health Access Program. However, that wasn't enough funding to implement the program statewide. This is an integrated care pediatric program that increases access for children and adolescents to behavioral health services through pediatric training, behavioral health consultations, telehealth, and care navigation. So this additional funding of $4.2 million was included in the budget to bring VMAP to scale statewide. This is especially an essential program because of the shortage of psychiatrists and psychologists in Virginia, but also in the nation when it comes to children. And because of that, providers may already be maintaining the behavioral health of their patients. And so this makes sure that they have additional resources to really make sure that they're providing that adequate care. So while schools are closed, we did have some continued advocacy around support staff in the schools again this year. Last year, we advocated around the school counselor-student ratio. We didn't quite get that 1 to 250 ratio that we hoped for. This year, we continued our advocacy because we know that counselors are highly qualified to provide mental health supports in the schools, but are often overloaded by that administration work. So as a result, we continue to push around our counselor advocacy in order to reduce this ratio. We received a total of $47 million to provide funding for one counselor for every 325 students in kindergarten through 12th grade. This would fund approximately 615 additional school counselor positions by FY 2020. Again, we don't know how the state and local budget is impacted by this pandemic, but this is a continued great success around this particular issue, and we continue to make momentum, increase momentum around this issue, particularly each year. Now, another initiative that you all may already be familiar with is the Family and Children's Trust Fund. The Families First Prevention Services Act, which is a federal act signed by President Trump, uses Title 4E dollars in order to transform our child welfare systems to preventing children from entering the foster care system, focusing on family preservation through evidence-based and trauma-informed services around early care, mental health, and substance use prevention. So last year we received $841,000 to implement Families First and scale up those state positions, as well as evidence-based services. This year, there's a total of $46 million over 2 years that would fund more evidence-based mental health and support services for families. This funding also includes a training coordinator position at DBHCS, and an additional $16.8 million per year through Department of Social Services to fund prevention services. In addition, there's $7 million for enhanced behavioral health services funded by Medicaid. However, we know that to implement these programs, we also have to provide workforce recruitment and retention opportunities. So another thing that we looked at was the base salary for DSS family services positions. We know that this is an extremely high stress job, and that folks in this workforce experiences a high level of compassion fatigue. We also know that to provide wonderful services, we need to be able to maintain our workforce in addition. And so with that being said, the JLAC report highlighted that the stability of foster care workforce is one of the primary challenges due to the high turnover rates for entry-level family service worker specialist position. The impact of high turnover caseworkers on children is found through the low rate of permanency and the high level of placements that workers experience. It's shown that the base salary for these positions at its lowest is a little over $30,000. An additional $5.6 million in general funds per year was adopted to address salary compression issues and raise base salaries of local DSS caseworkers. Similarly, for our mental health workforce, we need to do the same, but By increasing Medicaid reimbursement for mental health providers, this will give families and children more access to the services they need. The final budget included $6.6 million each year to increase Medicaid rates for outpatient mental health services. In addition, we're hoping that through the creation of a student loan repayment program, specifically for behavioral health providers, with intentions to accept a job through their community service boards, will increase opportunities for us to stabilize our behavioral health workforce. An additional $1.6 million per year is included to reimburse student loans for mental health providers working with the public health system. So those are our 2020 session successes around our campaign for Trauma-Informed Virginia, particularly, but I hope that you all will continue to engage with us. Reach out to me, Chloe, CHLOE, at vakids.org. I work with my colleague, Mary Baptista, on outreach and engagement at Voices for Virginia's Children, particularly at the community level. So keep us in the loop on what's going on in your community. Feel free to check in with us and stay engaged with these opportunities for engagement that I'll present. So we just had a Facebook Live chat with Dr. Danny Avula, the director of Richmond and Henrico Health Departments. You can still find this chat on our Facebook page at VA Kids or on our website if you missed it. You can gain insight on the impact of the coronavirus outbreak on children and families in Virginia, and also gain more insight on what we're doing in order to stay engaged throughout this time. Resilience Week in Virginia is coming up May 3rd through 9th. I hope that you'll use this opportunity to highlight ways that you are maintaining community resilience or contributing to community resilience in your locality, but also use this as an opportunity to take care of yourself. I'll play this quick intro promo video on ways that hopefully you'll get engaged. So feel free to tag us throughout the week. Let us know what you're doing in your community to build community resilience, especially during these challenging times. And I hope everyone will participate. It should be a great opportunity to participate in that during this time. Again, the census is something that we've continued our advocacy around. We want to make sure that all children are counted. This counting of everyone ensures that we receive a level of federal funding, which impacts our schools, nutrition programs, our number of representatives we get, health clinics, etc. So please make sure that you're completing the census form, make sure other people are completing the census to make sure that we count everyone. Children are particularly one of the higher risk demographics who are typically missed during the census counting. As you see, 2 million young children were missed in the last census, and we only get this opportunity every 10 years. So stay connected with us, follow us on social media. Again, share your story. You can reach out to me at chloe@vakids.org. If you have any questions, comments, or want to share what's happening in your community, make sure you subscribe to the Voices listserv as well to stay updated. We are sending out emails to keep you in the loop, and we're constantly updating our blogs if you're interested in any of our issues specifically. Thanks for taking the time to listen, and I hope to hear from you all soon.